So for hip flexion contracture, we have the bony palpations, the ASIS, muscle palpations, gluteus maximus. The osteokinematic is going to be extension. So you're going to have the patient laying on their stomach. And you have their leg up. And then you're just going to have their extension to lift their leg. For the osteokinematics, the extension. To work that out, you could have a weight on the foot and have them lift it again. For home exercise, you do a TheraBand, wrap it around the thigh, and lift that, or you're gonna have someone hold it. For the adductor strain, bony palpation is gonna be adductor tubercle. Your muscle is gonna be any of the adductor muscles, so you have 3 to choose from. Osteokinematic is gonna be hip adduction, so you're gonna have them lay on their side. And then you're gonna lift the top leg. You're gonna stand behind them so they're supported with the top leg, and you have to adduct their bottom leg up. Just like that. That's gonna be osteokinematic. For the exercise, you again just they can just do it just that with the weight of the leg. You put an ankle weight on, have them do the same exercise, and again with the band. You can either have them that, you can have them stand up on the side, put their leg in the band, and then they're just going to adduct the leg. You can do a crossing over the plane as well. And then for the osteoarthritis of the hip, bony palpation is going to be the greater trochanter. Muscle palpation is going to be the gluteus medius or the gluteus maximus. I'm going to show you the gluteus medius. Osteokinematic is going to be hip abduction. So you're going to have them laid on their side. And you're just going to have them lift the top leg straight up. And that's the osteokinematics. For the exercises, again, it's going to be just the weight of the leg. You do an ankle weight, have them lift up. TheraBand, you're just going to wrap the TheraBand around both ankles and lift it up. For Piriformis syndrome, bony palpation is again going to be the greater trochanter. The muscle is obviously going to be the piriformis, and the osteokinematic is going to be hip external rotation. So you can sit on the side, put your leg over, and the external rotation, she's going to bring the leg up like that. And again, it's going to be the same osteokinematic. To do the demo, you're just going to put either the weight of the leg or an ankle weight, have them do the same exercises. And for the home exercise, you can take a TheraBand, tie it around like that, put it on the ankle, and again, you're just going to have them externally rotating the hip. For OA of the knee, bony palpation is going to be either the femoral condyles or the tibial condyles. Muscle palpation is going to be the quadriceps, mainly the VMO. For the osteokinematic, it's going to be knee extensions, knee straight up. For the home program, you're going to be wanting to lay on your back. You're going to want to do the isometric of the squats, put your legs straight down. You're just going to have them tighten the quads and push the knee way down, count to 6 out loud.
1, 2, 3, 4, 5, 6.
Yeah. If you want, you could do short arc. Have them lift their leg up and count to 6. You can increase that with weights, and then the TheraBand would also be these exercises. Or if you want to do straight leg raises, straighten this knee, you're going to have them lift this leg all the way up while keeping the leg straight. For Patella femoral syndrome, the bone's obviously going to be the patella. Muscle is going to be vastus medialis again, and it's going to be the same osteokinematics of knee extension. The demo and the home exercise is going to be exactly the same as the OA of the knee. Still working the VMO. For the hamstring strain, bony palpation is going to depend on which muscle you're doing. You can do the ischial tuberosity or the head of the fibula. I advise head of the fibula. Muscle palpation is going to be any of the hamstrings you want to do. There's the biceps femoris or the semi-mem or semi-tendon. Osteokinematic is going to be knee flexion. So you do knee straight out, then have them flex the knee, or you have them do that on their stomach. And then have you lay on your stomach. For the knee flexion, you can have them do this with just the weight of the leg, or again, you can put the ankle weight or the TheraBand. If they're home, you can have them stand here. the leg in, and again, they're just gonna extend the knee. If you have an issue with that rolling up like that,
Put a towel.
you're just gonna take a towel and have them extend the knee, or flex the knee. For the MCL sprain, you're gonna do the medial femoral or medial tibial condyle, just make sure it's on the medial side. The muscle is gonna be the VMO. Osteoarthritis, knee extension once again, and it's gonna be the same exercises of laying on the backs with quad sets or the short arc quad exercises. For pes planus, the bony palpation is gonna be the calcaneus or the talus. Cannot be the navicular because that's not part of the subtalar joint. Muscle palpation is gonna be the tibialis posterior. Osteokinematic is gonna be ankle inversion, just like that. And then the demo would be ankle inversion with a weight on the foot. For the home exercise, you can have the TheraBand where you have them sit. We're gonna show you on the board. So you put it around the left leg, and then they're just gonna have them evert with that. You can also do it with a weight and just a towel and have the weight on the other side and have them move it in. For the foot slide with gait, bony palpation is gonna be the medial cuneiform. The muscle palpation is gonna be the tibialis anterior. Osteokinematic is gonna be dorsiflexion of the foot. And then with the demo and the home exercise, you can again just do that. You can have them lay on their back, a little bit easier. You can put the legs straight, and then you put a weight on the foot, and then just have them dorsiflex. And you do that instead of having them lay on the side, so that way it's not gonna fall out. And then with the home exercise program, it would be a band, have someone hold it, or again, put it under something lower. So you just lift it up with dorsiflexion. The lateral ankle sprain is gonna be the lateral medialis. The muscle palpation is gonna be the peroneals. Osteokinematic is gonna be ankle eversion, so move the ankle outwards. The demo would again be just a weight on it, have them move out. And then with the home exercise, you have a band. You would just wrap a band around both feet, then have them eversion against it. It's basically the opposite of what you're doing for the pes planus. And then for Achilles tendonitis, bony palpations, calcaneus. Muscle palpations are either gastrocnemius or the soleus. Whichever muscle you pick is gonna be what the home exercise is based off of. So for both of them, the osteokinematic is plantar flexion, push the foot down. For the demo, you can have them standing on the side, hands against, and you just have them lift up. For the home exercise, you'd have them sitting in a chair. You'd have a TheraBand. If you picked gastrocnemius, the knee needs to be straight as they do plantar flexion. If you do soleus, the knee needs to be bent as you do the plantar flexion with the band resisting. And that's everything.